Hello everyone, my name is Kartik Devgan. I am at Loyola University Medical Center. I am PGY1. Today I'll be presenting on which organs are affected by liver disease. Special thank you to Dr. Rubin for helping me out with this presentation. So the first organ I'd like to talk about is the brain. In liver dysfunction, you do not have a clearance of a substance called ammonia. This ammonia can build up and affect the brain, causing hepatic encephalopathy, which can cause symptoms such as confusion, disorientation, personality changes, loss of concentration. Treatment for this includes rifaximin and lactulose, which can help excrete ammonia. Another system that's affected is the heart. The liver and liver dysfunction causes changes in the hemodynamics and the flow and pressure of blood. This can increase the workload of the heart, eventually weakening the heart and impairing its ability to perfuse the rest of the organs. You can also have the liver dysfunction affecting the lungs. For example, you can have what's called hepatic hydrothorax, or buildup of fluid outside of the lungs because of leakage through the vessels and into the pleural cavity, a space around the lungs. You can also have skin manifestations. You can have jaundice, which is the buildup of bilirubin, which is usually metabolized and controlled by the liver. You can also have a buildup of bile acids, which can cause itching and pruritus. You can have also imbalance in estrogen, and so estrogen is a hormonal change. Increased estrogen is a hormonal change that happens in liver disease, which can cause enlarged breast tissue, decreased libido, hair loss in men, and can cause infertility and irregular menstrual cycles in women. Another system that's affected are the muscles. The liver is crucial to protein production, and when you have liver dysfunction, you have decreased protein production, increased breakdown of protein in other areas, and one of these areas is the muscles, and so the loss in muscle mass is known as sarcopenia, which is increase the risk of falls, increase your risk of fractures, increase frailty, and so what you need for this is a high calorie, high protein diet. Another system that is affected is the immune system. The liver is important to making certain immune proteins and also for increasing white blood cell count, and so when you have these systems impaired, you're increased risk of infection overall. You're also at increased risk of something called spontaneous bacterial peritonitis, which is the infection of the fluid in the peritoneal cavity, which happens because of the translocation or movement of bacteria from the normal gut into the space and infection of that fluid. You need IV antibiotics for that. Another system that can be infected are the intestines, and so the liver and the intestines are closely related. Blood flows from the intestines into the liver, and so when you have fibrotic or scar changes in the liver and liver disease, you can have a backflow, increased pressure, and that increased pressure is caused dilated veins, and this dilation can cause esophageal varices and can cause gastric varices, which are susceptible to bleeding. What you can also have is that buildup of fluid because of the backup of pressure, buildup of fluid in the abdomen, which can cause ascites. You need to remove that fluid, paracenteses, or with diuretics. Another system that is affected is the blood. You can have a decreased production of platelets, and you can have decreased production of clotting proteins that are normally produced by the liver, which increase your risk of bleeding. You can also have decreased production of anti-clotting proteins, which increases your risk of clot formation. Lastly, I want to talk about the kidneys. The kidneys require blood flow and adequate perfusion, and in the liver, you have something called splanchnic vasodilation, which diverts the blood flow and the pressure from the kidneys. When this happens, you can have acute kidney injury. Those are the organs that are affected by the liver system. Thank you for joining me today.